Hello, everyone. I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member, and this is an office hours that I'll be holding. And I wanted to make sure that there's a recording so that if you have to refer back, you can do so. So in this segment, I'm going to be going over the statistical applications in public health. And today is July 2nd. So let me start off by the description of the of the presentation that I'll be holding. And this was something that you might have received in your email. So today you'll be joining me in a session where I'll go over how statistical techniques can be used for public health applications incorporating social determinants of health. The description will have more emphasis on application than theory. So what is important and interesting is that when you are actually going through and working with your research, you want to make sure that not only is the statistical techniques sound, you also want to make sure that the theoretical framework aligns with the research questions, and you also have a problem statement and the significance and the gap. All of these things are extremely important that you identify initially before you start on your journey towards writing your doctoral study. Some individuals, of course, have the style to take a look at these first. However, in secondary data analysis, there are some caveats that are not present in primary data collection. The main thing with secondary data collection and secondary data analysis, more so, is that the advantage is that a lot of your data has been collected, even the IRB approval process had gone through. The disadvantage, and some of the larger data sets don't have this disadvantage. However, if you're looking at more local data that has been collected, a lot of times you're restricted to the variables that have been studied by previous researchers than something that you'll be collecting and looking at. I've actually done both. I've done primary data collection and secondary data analysis. Honestly, the representativeness for a secondary data analysis is way more than in primary data analysis. And of course, there's other challenges, statistical challenges that you have to and hurdles that you have to go through in order to understand how to best analyze one of the types of data gathering. So what are the objectives? And this is not going to be, I'm not going to be going over in this order. However, some of the objectives is, of course, revisiting some of the basic statistical tests. The reason being is that a lot of times in the courses, you're taking these statistical courses. However, when you're actually trying to understand what is going on, there aren't as many applications, and especially in the topic of interest that you're trying to work with. So if I give you a brief overview of some of the tests, you can actually see how the applications take place from what you have and how you can apply this to your topic. So again, I told you at the beginning that I'm not going to be going over these topics in the order that I have read to you. However, again, these are very important concepts for you to understand. So a lot of times people will go over the brief summaries and then go over the problem statement from the limitations from the existing literature that is available, and then in an orderly fashion go there. However, I'm telling you, and this is something that I've learned through not only conducting my research, but also helping students. And I've had many students, and many of those students have conducted secondary data analysis. So I want to kind of teach you, not only teach you, that's not my main objective. I want to kind of show you some of the tips and tricks that I've acquired and learned throughout the years about how to most effectively analyze some of this data. basically what I'm trying to say is that some of the techniques that I'll be sharing with you today are not something that you will see elsewhere. So what I wanted to do in this slide, and this might not have been clear. But before I go on, let me also go into some of these other ones. So the first bullet point says, look at other research methodologies that have been used by previous researchers. For instance, in my paper, what I did is not only, and I'm going to share with you the paper that I'm going to be that I recently had published. When I was doing my research and conducting my research, this was using National Health and Nutrition Examination Survey. I actually had to go into other NHANES papers to see how similar studies were done with the variables that I was working with. Now again, your study has to be unique and has to be one that has not been completed previously. So you want to make sure you don't want to copy the exact methodology that some other paper did and just use that as the foundation of your paper. You don't want to do that. However, think about this: you're not here to cure cancer. You're not here to solve all of the world's problems. You're here to only work on. You're here to work on a bit of a larger sort of research idea that people are working on. So yes, maybe you're not here to cure cancer. However, maybe you're here to see how cancer, what types of outcomes one cancer has over another. Now, these research questions have to be developed further because you have to have not only the research question, but the null hypothesis, alternative hypothesis. Another area to remember is that many students, and I'm also a prospectus reviewer for the PhD program in public health, and many students, what they'll do is they'll have one research question, and I've seen this multiple times where the student completed one research question and wanted to make sure that that was the only question that they were addressing. You have to have more than one. You really have to. I mean, some people do two, other people do three research questions, and then some people will go in and start doing 5 or 6 research questions. That's really overdoing it. Again, you don't want to be in your doctoral journey for years and years trying to answer all the questions. You want to make sure that you are addressing what you need to address and graduating. Something else, another observation, I actually was looking at a prospectus recently, and one observation that I had was that even though there were concepts in 3 research questions, however, hidden within each research question were multiple research questions that were available. So, like a construct like the attitude towards HIV. Well, attitudes towards HIV was actually studied in numerous variables. So either you you gear your focus towards one concept, or this is more difficult, and I've actually tried this previously, is create a composite score that will allow you to understand what is going on, say, in my example, attitudes towards people with HIV. So that was the first concept. And now the second concept is operationalization of variables. So the important indication there is how is each variable defined. What this means, I'm going to give you an example of this. What this means is that you want to make sure, in one of the recent oral defense presentations, the student was actually asked, how did you collect the data about, I don't remember the variable, however, let's take, for instance, depression. There's multiple ways to measure that. There's the patient health questionnaire. They're simply asking if you have depression, if a healthcare professional has told you that you have depression. And then there's another variable, and these are all actual variables that are in various data sets. The first one, PHQ-9, is actually in the NHANES data set. The two other variables, medicine for depression and others, healthcare diagnosed data, are all part of another data set. A caveat here that I'll warn you about, and this is something that is asked frequently, is that something that is asked is that how do you determine what came before what? Again, in a cross-sectional perspective, you have to kind of make an assumption that your outcome variable or your dependent variable actually came after the independent variable or explanatory variables. So for instance, an individual states that they have a history of diabetes, and then you're trying to determine if there is an association between diabetes and cardiovascular disease. So your cardiovascular disease would be the dependent variable. So when you're talking about cardiovascular disease, you're having to understand, you're having to make an assumption that diabetes came before cardiovascular disease. Now, that is not a far-fetched assumption because diabetes is a known risk factor. So if you can logically provide kind of an understanding of this, then you can really conduct the study. Looking at this, again, going back to operationalization of variables, in NHANES, some of the conditions are lumped together in order to create the variables. So for instance, in some of the conditions that are included in cardiovascular disease is congestive heart failure, myocardial infarction, and some of the other conditions. The risk factor for cardiovascular disease, hypertension, is not included, and many people make this mistake, is not included within the variable. So what is very important is to take meticulous notes and to determine, really know before you're going into your dissertation defense, how are your variables defined. Once you know that, everything will kind of you'll start to understand everything. The third thing that I wanted to emphasize on is if you want to dichotomize a variable. Now, what does dichotomize mean? So you have a continuous variable. Let's say you have BMI, right? Body mass index, as a continuous variable, and this is something that many of you know with height versus weight calculated. So a BMI typically, I mean, you can actually do a BMI you can actually look at BMI at a continuous variable level. However, the problem is, how do you interpret that? So you're trying to run a logistic regression obesity, and BMI is something that is an outcome variable, possibly. How do you actually interpret that when this is a continuous variable? Alternatively, what you can do to dichotomize this variable, and this is where I'm trying to give you that example, is try to dichotomize this into obesity present and obesity absent. So as you know, if you've done research in obesity, any BMI that's greater than or equal to 30 is considered obese. So in my research, what I do is, instead of using BMI as a continuous variable, I'll, in all my research, translate that to a categorical variable and a dichotomized categorical variable, whether used as a dependent variable or an independent variable. And of course, I give another example of the Likert scale, not scale. And that kind of goes into understanding again how to dichotomize. One of the important tools that is used through dichotomization is food insecurity, and I'm going to go over some. I've published a lot in this area. Many people have cited some of the research that I've conducted with collaborators. I'm also, so just a segue, I'm going to be going over some of the particulars of the journal of publishing. Now, I'm not going to go into a whole lot of detail because some of my colleagues covered that in a lot more detail. However, I want to kind of show you what this entails, because there's actually a lot of hidden factors that you have to take into consideration that are that are very important. So all of this, what I'm teaching you, all of these things are very important to consider before completing your study in the dissertation, or even research that you'll be publishing within a journal. Honestly, many people think that once you have a dissertation, you can publish easily. However, publishing research in a journal has much more ramifications than having to publish a dissertation. I'll have to say though, having a dissertation, publishing a dissertation is no easy task. That in itself is very difficult, and I've got a PhD. I don't think I will be able to do another one. Realistically speaking, I probably would enjoy doing another one. Anyway, so I was going over this and alluding to this in the previous slide. However, I'll go through this a bit more detail. So again, the Patient Health Questionnaire 9 has multiple questions. These are all a part of the depression scale that you're asked about in a doctor visit that you might be going to. And a lot of these go into some of the categories such as sleep, losing interest, and some other areas. This is when I was in med school, we actually had to make sure and memorize this so that we can ask this to the patients and whatnot. So again, this is an aside. So on a clinical perspective, Patient Health Questionnaire 9 is what is emphasized. There's another way to measure depression, is that have you been diagnosed with depression, and you directly ask that in your questionnaire. What I find is that NHANES goes into a bit more detail, whereas NHIS, and I'm throwing out these data sets like you've been dealing with these or working with these forever. However, I'm just trying to give you a brief overview of all of them, and I'm going to go into a lot more detail actually in the respective data sets. Another one that I found really interesting, and I'm trying to make use of this because there's not a huge sample size here. However, individuals that are currently taking medication. Let me go off to an aside here. So the idea is that you're trying to understand the connection between two variables in mortality. So you're trying to look at the history of lung cancer and overall mortality, and you're trying to see if depression has an impact on that. So typically, if this is healthcare diagnosed, you really have no idea if the cancer came first or the depression came first. Maybe the person was already depressed and they developed cancer, and then after that there was increased mortality. Ideally, you want somebody that already had cancer, and then to see how depression affected the outcome. Combined effect of depression and cancer resulted in an increased mortality. So there are several assumptions, and this is something that was brought up by reviewers in one of the papers that I collaborated on. And this is an assumption and a limitation that you have to kind of live with when you're conducting this analysis. So what's my point here? The point is that you want to make sure, not only do you want to make sure that you're conducting the study in a way that you're taking everything into consideration. However, also you want to make sure that you are considering what you're not doing. So all of these things go in the limitation section. So there's multiple types of biases, and these are similar. So if you're running an NHANES analysis, the advantage is that some of the limitations remain similar. So I'm not saying copy word for word verbatim some of the limitations from other papers. However, that can give you kind of a clue about what types of limitations that you need to write about. And of course, there are some areas that require a bit more elaboration. For instance, sometimes there's not an adequate sample size to observe an effect. That may be a limitation. Also, you might have a limitation about the area that I was talking about knowing if cancer came before depression, or depression came before cancer. So based on that, you want to make conclusions. And what is common is many times for you to have limitations. Some people think that having a limitation means that your study is no longer valid or applicable. Remember George Box's, he was a famous statistician, his statement that most models are wrong, some models are useful. So what the meaning of this is, you won't find a model that addresses everything. There's no way to do that. However, what you can do is try to understand what are the optimal models that you can use to explain the phenomena that you're trying to look at. So we're going to switch gears here to talking about how to address reviewer comments. So this is actually a reviewer comment that I was working on just last night. So this is fresh in my memory about what I did. And this was looking at understanding food insecurity, CKD, and overall mortality. So basically, we know that chronic kidney disease leads to overall mortality. I mean, this is a serious condition. I've worked in nephrology clinics, and they have a shorter lifespan than a person that doesn't have these disease conditions. So chronic kidney disease, of course, is something that also exacerbates the presence of other diseases such as cardiovascular disease. Actually, my dissertation was on something called cardiorenal syndrome, and this was something that was up and coming when I wrote the dissertation. Anyway, I digress. So let's take a look at these reviewer comments. Some of these comments, honestly, did not make sense. I actually spent a lot of time trying to answer these comments, and the reality is that sometimes you'll be able to address the comments, and then other times you might not understand what the reviewer is saying, or try to answer the comments as best as you can, and that's all you can do. Even what is an interesting concept is many people get discouraged when they get major revisions, right? However, the idea is that when the editor is indicating for major revisions, that means that the lead editor is not necessarily saying that your topic is inadequate, or the paper is ineligible to be published in the journal that you're looking at. That's not the point. The point is that they're wanting to improve. They're wanting to see you improve the the paper and be able to submit. What you'll see, these things are not uncommon. You'll see a lot of back and forth between reviewers returning the paper with comments. A lot of times that may need multiple revisions, and there's a lot of back and forth, that is needed for that. So let me revert to this and actually read some of these comments. So table 1 should be improved to describe how each variable was measured. I didn't necessarily include table 1. However, if you looked at table 1, there is no way possible to include all of the operationalization of each of the variables. What is important and what is typically done, what is actually customary, is to in the method section to include to include in the method section the variables and how they're defined. So I basically define those variables a bit more in a bit more detail. So after that, the reviewer writes, and this is one of many comments that the reviewer gave. Also provide mortality percentage. I went in there and did that, and then what I did that. What I did is and this is something that you have probably seen in the review process in the doctoral journey. What I'll do is I'll make the changes in the file that the actual paper is included in, and then go in here and kind of answer the question that they're posing. So this is looking at the main limitation of the study is the low rate of food insecurity in CKD patients, approximately 164 patients. That is not a small sample size. Which is not clear in the manuscript. So basically, instead of criticizing what the commenter is saying, that you want to make this a bit more clear, you might want to include this in the limitations and whatnot. So the association seems not appropriate as actually done to support conclusion. So here, to address this, what I did is kind of change how the paper was reading. Some of the areas were not quite aligned. There were areas where and errors are very much a part of the publication process, and something that is very human. So if you go in and take a look at some of these publications, in this publication, in this actually publication that is in progress, we changed one word, and this is interesting because this demonstrates how important each word even is. So the word that we accidentally changed is, instead of saying a longitudinal study, and that has kind of a long-term follow-up going on, we wrote cross-sectional, and that changed all of the conclusions. Well, it didn't change the conclusions. However, it changed some of the ways that some of the reviewers were looking at this. So one reviewer indicated that there needed to be an R-squared to look at the strength of the association, and this was not something that was available for people that run Cox regression. Here I'm still trying to answer this. The main area of study was that if there was a connection between CKD and mortality, and if food insecurity modified that effect. So this is the main place that I actually included this statement within the paper. And I said, for this reason, we decided to include some more information for clarification and alignment. Like I told you, the conclusion is that individuals with CKD and food insecurity have a higher likelihood of mortality than those individuals that had either factor alone. So individuals that had CKD alone or food insecurity alone did not have as increased increased mortality likelihood as individuals that had both. And I also indicated while the rates included this in the discussion, and then while the rates are low in the sample, the conclusion about the relationships should still be the same. So the sample size, I do agree that with the reviewer that the sample size is smaller. However, what I'm trying to say is that some of these relationships, they still don't change. And then this was all described in the manuscript. We also included the non-CKD population for the reference to study effect modification. So this is kind of looking at, and I'm going to be going over interaction terms and how to characterize these. So again, that's what is going on. Let me write this out here. Sometimes people learn through visual representation. So what I'm looking at here is CKD, and then taking a look at overall mortality. And then when you're looking at the additional variable, and this is something that I've been using with students for years now. So there's a third variable basically, and this is something that I introduced. Well, that has been done previously, however, this is something that I popularized. So when you have both of these variables, then the effect for overall mortality is higher than each individual variable. Here's more comments. I mean, you can take a look at this and read this. A lot of times, and this is something, of course, that we forget sometimes, and let me move this so that you can see. So what was the significance level? I mean, some people might have a significance level that's 0.001, and that was a statement that we forgot to include. Race, ethnicity was something. So they were trying to, they're asking us how we define this. And basically race and ethnicity was determined by non-Hispanic white, and then non-Hispanic black, and then Hispanic, and then other. Now, in one of my one of the research that I conducted, what I did is I lumped together the minority groups and then compared these individuals to non-Hispanic white. So what am I saying here? Try to dichotomize variables that make sense. I mean, you don't want to create variables and dichotomize them that necessarily hasn't ever been done. And if you're doing something for the first time, then make sure that you have a justification as to why you did what you did. These are things that your committee members will ask you all the time, that why are you doing this? What are some alternative ways that you can consider this? I mean, this is how you learn research. So now that I've shown you reviewers that basically tear open your paper and give you comments. Now, I mean, I'm saying that in a light manner. So I mean, the reviewer comments are important. However, here's the final product, and this is always rewarding to see. And this might be a kind of a nerdy thing to be saying. However, when you do see a research paper that has been published, and one of the first ones in C-reactive protein, because this is something that was part of my dissertation many years ago, and finally I got the opportunity with other collaborators to be publishing this. So when you see your name, and there's my name, and there's my main collaborator, Dr. Kubchandani, and then there's actually opportunities. These were some of my former students that just graduated this year, and I'm always looking for collaborators, student collaborators, that are that are a part of this. So now I want to bring to your attention how an abstract is written. Abstracts are very difficult, honestly, to write, and the main reason is, first of all, let me tell you, abstracts are a very important way to communicate research. Many times during presentations and whatnot, like I'll be presenting at APHA if everything goes right. And one of the ways I've been accepted in 4 presentations, and so the abstracts have been accepted. And what was very challenging was to be able to take all my research findings and be able to provide a small abstract, an abstract that was not as many words. So imagine this. You're taking a whole 200-page dissertation, 100 to 200 pages, and you're trying to condense the main findings into an abstract. How do you even do that? How do you even begin to do that? Well, what is interesting is to try to understand the order in which an abstract is presented. So an abstract, you have a background or introduction, depending on what the ramifications, what the requirements are. So you have a background, methods, results, and conclusion. And sometimes people will say, and this is something that is common, and that's kind of a template for everyone. Intro, and this is called the IMRAD. You might have heard of this. Intro, methods, results, and then discussion. So these are the areas, and typically, I've seen anywhere from anything as short as 200 words. Some of them say 250, and then others will tell you 300. So this is not many words, and as you can see, there's not many words available here. What are some of the important portions? Well, you want to have like 2 sentences in your background, and kind of tell everyone why your topic is important, because of what kind of visiting what's out there. So we were looking at COPD, and for those of you that may not be familiar with this condition, this is comprised of emphysema and chronic bronchitis. So again, I'm kind of reverting back to understanding how to operationalize variables. How did I know that COPD is considered emphysema and chronic bronchitis? Well, for one, I actually access my medical knowledge and background. However, as I taught you earlier within this presentation, one of the major things that I used is and when I say I should say we, used was looking at previous papers and how they constructed their variable of COPD. And once I did that, I was able to know kind of how to progress in our research study. So again, let me draw this diagram here. CRP, C-reactive protein, and all-cause mortality. I'm just going to write mortality. And then, so let me actually switch this here. So the main predictor variable, main independent variable was COPD. The main outcome variable was mortality. We were looking at if C-reactive protein, along with COPD, has increased likelihood of mortality, and we found statistically significant relationship, and in fact, were combined. These are indicative of increased mortality than each individually. What does that mean? Well, you can actually use inflammatory biomarkers such as C-reactive protein as potentially early detector biomarkers, so that you can measure the C-reactive protein and see if this is indicative of increased likelihood of mortality. So control the CRP. I mean, monitor and control. And the medical portion is actually a lot deeper in trying to explain everything. So this is pretty much the tip of the iceberg here. So I want to quickly kind of list these data sets, those that are at your disposal. These are freely available on the internet. And today, you can go in and take a look at these data sets. You'll have code books that you can retrieve, and a lot of other data sets that you can conduct secondary data analysis. Now, I'm not trying to make the point here. I know I've been repeatedly saying secondary data analysis. I'm not trying to make the point that secondary data analysis is somehow easier than any of the other types of analysis or research studies. What I'm trying to say is that each type of research has difficulties and challenges that you have to face and understand. I mean, one of the major sort of drawbacks of using secondary data is that the variables that you had initially thought would be available for some reason is not. What I'm trying to say is that not that the data is not available, sometimes, and you will see this in NHANES, NHIS, sometimes the years that these questions are asked are not necessarily there. So for instance, what I'm trying to say is in NHIS, this is a study that I actually just conducted recently, where I was looking at job harassment, job insecurity, and work-life balance. Initially, I thought, I could conduct a regular cross-sectional study and make it a recent one because you want to possibly look at 2018 or 2019 and whatnot. And what I found is that the last time this data was collected was in 2010. So it doesn't matter how many years you combined, you still have to go to 2010 and retrieve this data. And the next question is, if the data is from 2010, why would this be relevant in 2024? I mean, this was collected 14 years ago. So the way what we studied was something that is, what we are currently studying is that there's actually follow-up data. So even though I told you that there is 2010, remember at the beginning of this talk I said that when you follow up through 2019, number one, you're able to study mortality in a longitudinal level, and then number two, you're able to use a year that's more current, and then reviewers and individuals that are looking at this research will be able to determine and understand that this is way more recent than the other, than looking at just 2010. So 2019, why even go to 2019? I mean, already this is getting 5 years old. However, the CDC and other places have not released any of the additional follow-up data. You would actually have to go to the research center located in Hyattsville, Maryland, to access this data. And by the way, another caveat of accessing data sets, especially when it's secondary data analysis, is there might be a cost attached to this. So, for instance, one of my students, they paid $1,000 to access their data set. This kind of money, honestly, some people have, however, most people don't necessarily have that amount. So you just have to kind of look around and see what is the most optimal data set that you want to be using for your study. So what are some data sets available? I've been ad nauseum telling you about NHIS National Health Interview Survey. Medical expenditure survey. This is something that is available, easily available and accessible through the IPUMS dataset. I'm going to be going over a demonstration with that. Again, national health, and I've had about a decade of experience in going through, and if you go through my Google Scholar page, then you'll be able to see all of the publications that I've made. Then I've used, I haven't really used this frequently, however, behavioral risk factor social survey, this is another one. I haven't quite used the surveillance epidemiology and results here. And then there's the healthcare cost and utilization project, HCUP. And then there's the CDC Wonder, youth risk behavior surveillance system, demographic and health survey, and then All of Us research. This is one that I'm going to use and have seen more people use in public health conferences and whatnot. So here are some characteristics of NHIS. I'm just going to read through this because this has already been quite a few minutes here. So this is a respected, reliable, redesigned, rediscovered. This is the motto here: respected, reliable, redesigned, rediscovered. And this is what is National Health Interview Survey. Has been around since 1957. The nation's longest running household-based health survey. NHIS is the gold standard for healthcare access data, health insurance data, and disability data. This was actually redesigned in 2019. One note about merging multiple years. So when you're studying things in the general population, that's something that you will have adequate sample size within a year. Now, when you're starting to go into kind of a remote consideration, so when you're looking and studying a population that is smaller than the main population, when you're looking at a subpopulation, sometimes you have to actually combine years. So what I did, and one of my students did, and he graduated this year, was look at a National Health and Interview Survey combining 2011 to 2018. And again, there's some caveats here in terms of using sample weights and being able to combine all of that and be able to do so. So 2010 to 2018 was a combo. Now, why didn't I combine 2019 with that? Because NHIS techniques were redesigned. So you have to be very careful when you're combining years that they're, for lack of a better term, combinable. So here's some chronic diseases, and these are diseases that I've been looking at recently. Taking a look at this, again, I went over this previously, the depression multiple ways to measure, so I'm not going to go over that right now. There's diabetes, cardiovascular disease. Again, the strength is there is a huge sample size, as you can see. However, there's no laboratory information. So when you look at NHANES, you have the creatinine clearance, and based on that, you are able to understand chronic kidney disease and how that plays out. This is some data. When I mean database wrangling, I mean how I'm trying to show you something a bit more complicated and not something that you not necessarily will be using here. However, if you have this in mind, then this might make your analysis that much easier. So this is a data set that I was using, basically NHIS from 2010 to 2018. And I started off by combining all of the years in SPSS. So this was actually done through IPUMS that I combined. And I'm going to go over a demonstration fairly shortly. So SPSS, what I wanted to do is convert SPSS to Excel, and I'm going to give you the reason why in a moment. So SPSS, I needed to have smaller files to be able to get this to Excel. I actually spent a whole day trying to figure out why my SPSS file would not convert to Excel. There was actually an error that was being created. And so the one solution, and you'll see that you'll have to actually come up with unique solutions to some of the challenges that might be surrounding your research idea. So in order to circumvent the problem of a large data set, and when I mean large, I mean 1 million data points. I mean, these are not anything that's small. This is a lot of data. So what I did, I split the files. Then, because the sample size was smaller, I was able to feed that into Excel. So I split that into 2 files. Initially, I split uneven, so the other data set that was used, but it did not. The larger data set was not able to be read through Excel. Why even worry about Excel? Well, the reason being is that there are certain formula that you can use in Excel to convert, and the only reason was to understand time. To convert the mortality time from quarter to be able to define that by months. I'm not going to go into detail about that. Just know that there was one variable that I was working towards, and for that reason I had to convert this to Excel. So once I was done with Excel, I returned that to SPSS and merged the files, and then converted that to a CSV file. The reason for CSV file is to ensure that the size of the data set was smaller, and the reason being, again, you have to be thinking about the end in mind before doing the beginning. SAS, my SAS, the copy that you own, if you want to own a copy, these are cost prohibitive. However, for years, SAS has a SAS University Edition actually has a cloud, and there's not much room for placing data sets in there. However, if you want to translate that to there, you're going to have a smaller file, and CSV does just that. So now I'm going to talk about the syntax and how this works. Many of you are familiar with the data, kind of the menu-driven SPSS, and I've heard many students say that because of that menu-driven function, they're able to learn and understand SPSS over some of the other statistical packages, such as R and SAS. They're also starting to become menu-driven. However, some of that becomes quite cumbersome and complicated. So you want to have a menu-driven. You want to use the menu-driven feature of SPSS. However, I really recommend you start to get used to the syntax. And what I do is when I write my syntax, I include the notation. So if you have an asterisk here, and then after that asterisk you put a comment, then when you're actually running the syntax, you're able to translate some of these variables to ones that you can manipulate and better manipulate. So this is looking at sex orien. This variable is a variable that is available within the NHIS dataset, and what you're doing is you're translating these datasets into variables that you can actually understand. So again, this is an NHIS variable, and you're trying to determine how to translate that to your variable. So this is the name of your variable, and you're recoding here. So what I did, and I wanted to keep a note here of what I did, there were 3 categories for diabetes. There's people with diabetes, people without diabetes, and people with pre-diabetes. And many reviewers and many people ask you, why did you include one or the other? In this variable, what I did is I actually combined diabetes and pre-diabetes and considered that as having diabetes. And one is not. However, here what I did is I just got rid of prediabetes and took a look at people that have diabetes and those that do not. So this is again a kind of a simplistic dichotomized variable. You might be asking, why didn't I use and keep this as 3 categories? And this is simply because when you're and this is an important point, when you're dividing this into categories, what happens is that one category will have such a small sample size that you're not able to really make any conclusions out of that. So what I'm saying is that, for instance, people with prediabetes have a really small sample size. So if you haven't really combined many years, or if you don't have an adequate sample size, then you want to make sure to create a variable that kind of makes sense. Wanted to share with you the variable. The reference that we came up with. The reference for the journal that we submitted this to, so that you can have this for your reference. When you're looking for this, look for an impact factor. Make sure research aligns with the objectives of the journal. Again, I went over this already. This is Redesign 2019. Another comment that I wanted to make here is that when you're looking for syntax, you want to take a look at what is the syntax that they have provided for you. Based on that, what you can do is simply copy and paste this onto your syntax document so that you can have this for future. Unfortunately, I don't have time to go over some of these variables, some of these statistical tests. What I can tell you is that nominal variables are categorical variables, ordinal variables are more like the Likert scale, interval and ratio, they're continuous variables. So there's some controversy as to if ordinal variables are categorical or continuous, depending on what you have and what other people have considered. You kind of do the analysis based on that. So really the main types of variables that you're concerned with is continuous versus categorical. Nomenclature, and this came out of a conversation that I had with one student, is that how do you differentiate between bivariate? Bivariate means 2 variables. Binary, and binary is 2 categories, and then a multiple regression, that is typically an outcome variable that is dichotomous. Here's an interesting sort of statistical test that is used here. Here's a algorithm that you can use. Replace quantitative with continuous, and then take a look at where each of these end up. And then this goes into some of the regression analysis, going into some of the statistical tests, and take a look at IPUMS. What I'm going to go over is take a look at IPUMS and then wrap up. So like I said, in a lot of my talks, I like to include a demonstration. And in this demonstration, I'll show you kind of orient you to how IPUMS works. First of all, this has a plethora of data and data sets that you can access in order to run your analysis, secondary data analysis. So let me focus on NHANES here, and you can actually get data create and extraction. Let me log into my portal. And then give you more of an overview of how this works. So now that I'm logged in here, now I can kind of show you the menu and whatnot. So here I'm logged in. Go into, so here's my data already that's available here, the extracts. And then you can kind of download this. And then there are SPSS files that you can directly access. And you can actually go into resubmit and take a look at some of the files that are available. I'm not gonna really go over this. However, here's a code book that you can easily access and take a look at what a lot of these variables mean. Let me go into select data, and you might be looking for something like so you might be looking at something like depression, right? Because we talked about this a lot. So the interesting thing here about this variable is that had depression in the past 12 months, meaning that this is something that is recent. Remember I was telling you about what came first. Well, when you have in the past 12 months, that confirms that. So it's a great variable. I mean, I'm going to use this one as an example. Take a look at this. Some said no, some said yes. And what you want to do is not only the category available, you want to also have a case count view. So what does this mean? Most people actually did not answer this question. 6,886 said no. And look at this, the only amount of people that have this sample size is 195. So this is not quite ideal to be using. And I'm going to show you something else here as to why you can't use this. So this is only asking children, for sample children. That's one thing you need to consider in the description. You have to visit these things before you make a conclusion about what you're going to be using. Here is the major caveat or hurdle. This variable is only available for 2007. Remember I was telling you how on earth are you supposed to convince readers that this is something recent. As far as this is concerned, you can't really do that. Let's return to the condition variables list and let me show you something. So taking a look at depression, and I was going to show you for depression, however, ADHD is included here. So ever have ADHD? This is available all the way from 1998 to 2022. So you can combine a lot of these years and be able to determine what's there. In terms of has abdominal pain past 12 months, this was only asked in 2007. So you're not going to really get current information, and the number of respondents are not necessarily adequate to really find anything meaningful. This wraps everything up. There's a lot of considerations to be made when you're considering a secondary data analysis. There's places where you have to do kind of not only understand your variable, but also be able to kind of determine and be able to kind of out of memory really how your variables are defined when you're conducting your study. So these are all